So hi, my name is Dr. Grewal. I'm one of the trauma surgeons at South Nassau. I want to take a quick minute here to describe to you one of the courses we offer here for everyone to take. It's called Stop the Bleed. This course came out of a lot of tragedy that's occurred over the past few years with mass shootings and massive casualty events that required acute interventions to have the best survivability. This Stop the Bleed course we're going to talk about briefly today is a 1-hour training course that teaches non-healthcare providers what to do if they're faced with life-threatening bleeding, no matter what the cause. First thing you're going to do is you're going to ensure scene safety, right? As difficult as it may be to leave someone, you must protect yourself first so that you can then help others. Second, you're going to get help. You're going to call 911. Third, you're going to assess that patient for life-threatening injury, removing clothes down to the skin if possible to assess where that active bleeding is coming from. Fourth, is there a trauma kit available, much like the one we have here and we'll have posted in our hospital? If that's available, you have adjuncts in there that you can use to help. One of those is the combat application tourniquet, gauze, and chemical dressings to help stop bleeding, right? If not, you're going to use any clean, dry cloth you have. You can apply direct pressure over the wound. So if there is a trauma first aid kit available, you want to assess where the wound is. If it's on the arm or the leg, you can apply the tourniquet. If it's in the neck, chest, or torso, you're going to apply direct pressure, right? And then lastly, after that, you're going to get that person to a trauma center as soon as possible to ensure hopefully a good outcome. So if you see a penetrating neck injury like this, you're going to just basically take some gauze. You're going to apply direct pressure over that wound, right? It's not a large forceful pressure. It's just enough to control the bleeding. Obviously, in certain parts of the body, more force may be necessary to have that done. Now, if you have an upper extremity injury that's like this, you're going to actually apply what's called the combat application tourniquet. You're going to slip the affected limb through this. You're going to actually raise this above where the active bleeding is technically occurring from. You're going to cinch it down to where it's extremely tight. Bring it around. Once this portion is done, you're going to take your windlass rod. You're going to twist it down as many times as you can till the bleeding stops. Once that is complete, you're going to tuck it in the clip. You're going to take your strap, put it over the remainder of the tourniquet, and then put your time strap over that to secure everything in place. If there's any questions, or you have more interest in this course, please contact Allison Anderson of the Trauma Department at South Nassau. Thank you for your time.